All right, I think it's the top of the hour, so we are going to go. Hi, everybody. This is Valerie Van Boeven. I'm a registered nurse and the co-owner of Approved Senior Network Marketing, which used to be called LTC Expert Publications, but then we got our trademark. So we rebranded a little bit. Same people, same company, new name. So this is deep dive number 2, cost-effective and organized caregiver recruiting. Wowza, caregiver recruiting is a large stress. It's time to up your game and maybe save a little money. I'm hoping that some of the tips that I share with you today can help you save money and time. So here's what I need you to do though. Know that I am going to perhaps periodically stop and answer a few questions, but there's a Q&A section. There's a chat and there's a Q&A. If you use the Q&A feature and not the chat feature, that works out a little better. So I will take questions. So don't wait till the end. Type your question in as we go, and I'll take them in the order received. All righty. So here we go. So let's save you some money. All right. Recruiting wish list. We're going to stop here and talk about your recruiting wish list. Now, off the top, I know that your real wish list is that A, people would show up for interviews, and B, they would turn in their paperwork, and C, they would show up for interviews and orientation. And those are all pieces that are 100% the human element that neither I nor anyone else in the world can affect. I don't understand the thought process behind a human person telling you they're going to be there for an interview and never showing up, except that it used to be that caregivers needed a job, and now we need caregivers more than they need a job. And so I'll stop there because otherwise I'll go on and on and on. But the truth is there are some really, really good people out there, and there are some gems. And so we're going to talk about things we can affect and we can help with. And I'm going to say this again later, but really, it's a numbers game. It's a numbers game. So here's what I hear from our clients. And I'm going to guess that a lot of you on this call have the same wishes beyond what I just said. Of course, we wish everybody would show up for an interview. And aside from going to their house and actually getting them, not going to happen. However, they might show up virtually better than they would if they had to come to your office. I don't know. And I don't know if that's good or not, but we'll keep going. I wish I would have more time to do the back-end follow-up with candidates. If I didn't have to worry about the ads, the triage, and the initial outreach, I could do more to get people coming to the office. I hear that a lot. And that's one of the problems that we help our clients with. I don't understand how to make Facebook, ZipRecruiter, Indeed, or any of those platforms work really well for us. I'm winging it, and I wish somebody would do that for us. They can all be complicated. Facebook has ways they want you to advertise versus ways that work a little bit more cost effectively to advertise for caregivers. So it is a little bit complicated. We do that for our clients to take away all that upfront stuff, but you can also learn a lot about ZipRecruiter, Indeed, and Facebook. I wish I had a way to mass email and mass text potential employees and current employees without having to spend money on RingCentral, plus a CRM, plus other software. We've got you covered there. I wish the job application on my website was not a PDF. And folks, let me just tell you this right now. It shouldn't have been a PDF before COVID-19 came around, and it shouldn't be a PDF today. People are on their smartphones when they're doing their applications, and they cannot, most of them don't have a printer. Most of them don't have a desktop. Most in this, maybe some of the higher, professionals and that probably do. But if you're looking at caregivers, they do not have those devices in their homes, chances are. And right now, it's getting better, but almost impossible for them to go print it out somewhere. So understanding that, getting away from PDFs that people download on your website, that's a really good idea right now. If you're still there, We need to fix that. You'd like a full-time application that zipped the candidate's data right into a CRM of some kind. I'm going to tell you what a CRM is in a minute. If you've never been on a call like this before, I'll tell you what that is. I wish I could have multiple users of a CRM without paying per user per month. It gets pricey. How many of you have something you use? Maybe it's, I don't know, I'm going to use one that's not in our industry, like Salesforce. It's a place where everybody can log in, even Zoho. You can log in. That's what, we have one of those. But every time you sign up a new person, you have to pay another $30 per member per month or $99 per member per month. You don't need to do that anymore. Okay. I don't need tons of bells and whistles. I just need a good volume of candidates rolling into my system. I totally get that. I wish I could try a new way to get organized without a long-term commitment. So in other words, setting everything up and then having to actually commit to a year or even 6 months is really a stretch for some budgets. What if you could just do it month to month? That's something that we'll talk about. All right, so here's what I want you to do. If you are taking notes, and yes, this is being recorded, and yes, I will send it out. But if you're taking notes, here's the first thing you need to do. And I am not a numbers person. My business partner, George Novison, will tell you that he has to kind of dumb it down for me when we're talking about stuff, and I totally appreciate that. I don't like numbers. That's why George is a good business partner. But I need you to do this or talk to whoever it is in your life who's a good numbers person. I want you to take a look at all the expenses that you have accrued for recruiting specifically. Now remember, recruiting is a lot like marketing. So and it takes some marketing at this point to get good caregivers. So you probably have ads running on Facebook or Craigslist or ZipRecruiter or Indeed or other places. You probably have some software that you use. You might have a CRM that you are already using, which is like a Salesforce, Infusionsoft. There's some in our industries, MyCNA Jobs, ClearCare, AccessCare. There's all kinds of softwares out there. You might also have, in addition to all that, a phone software. I hear a lot of people say they use something similar to RingCentral, and there's many of them out there, in addition to all the other things they have. Then there's the staff time. It might be your time because you're just a small company with 2 or 3 of you. It might be a full-time staff member's time. In some cases, it might be 2 or 3 staff members. And there's paperwork time. Oh my goodness, chasing people for paperwork and the follow-up, and there's that kind of time. And that all counts. That's all money. Time is money. And then there's the turnover. It's much easier to retain, and there's webinars all day long on employee retention versus the expense of having to start all over again with a new person. I'm not going to shove retention down your throat. You all know a lot about that, and you know that, and I can see from working with hundreds of you over the course of the last 12 years, maybe thousands, that the folks that retain the most caregivers are the ones that treat them the best, that honor them, that shout out to them and say, thank you for what you do. I know it's not easy. And if you're not doing that and on a regular basis, then it's not going to solve all your problems in retention, but honoring those people who take care of our seniors will help with retention. And you have to make a big deal out of it because they don't get a lot of big deals in their life. So that helps a lot. So I want you to take a look at all these, and I want you to write them down on a piece of paper. How much do you think you spend per month? How much do you think you spend per year on all this stuff? And I want you to kind of have that number in your head. Let's talk about now where and how you can recruit for a minute. You can use Facebook, ZipRecruiter, Indeed, Craigslist, and there's a million more, right? Glassdoor. I don't even know if Monster.com is a thing anymore. Or Yahoo Jobs, there are your local paper that's online. There's MyCNA Jobs. There's Caregiver List. There's, oh my gosh, there's a million of them. And you can also you can't do job fairs right now, probably, maybe this fall, but there are job fairs where you can recruit, and there are employee referrals, which tend to be, especially if you offer a little thank you to your employees for referring a good new employee. There tends to be a better batch of people coming through when you get an employee referral. That doesn't mean they're amazing, but in a lot of cases, that's a better fit. So think about all the different ways you can recruit and where you're spending money. And we're going to talk about some of those things. The next thing people ask me all the time when we're doing their recruiting with them is, do hiring bonuses work for caregivers specifically? And I would say yes, they do. They do get your ads answered better if you offer a hiring bonus. Not all of you are even willing to go there. I get it. But they do help, especially if it's the top line of your ad. I'll show you an ad or two. But you have to use caution. And if you're going to put a number in an ad, you have to be able to follow up with that with some very clear rules for collecting that money, determining how the payout will happen, and be very clear about that, and never give the whole bonus up front. I don't know if any of you would do that, but I know there have been people who have done that. And guess what? You'll never see that person again. Use a very strict process, because you don't want people, obviously, just coming on board for the bonus, but it does help. So just as an aside, I put together this process because we've talked about it endlessly with our clients. If we're going to advertise a hiring bonus and we can afford $100, $200, I've seen $500 sign-on bonus. How do we dole that money out without being seeming shady up front? And, how do we best keep them on our staff for as long as possible, but still give them their money? So one or two of our clients, we've worked out this, and I'm just using $200 for a round number. You can make this whatever number you want if you're going to do this at all. Paperwork. Is it completed and all turned in so that they can start working? That's $50 of their $200 bonus. Have they attended orientation? They get paid for that day, whatever their hourly rate is, plus $50 for completing orientation. Then they have to take hours and they have to work for 2 weeks without any call-ins. So even whether they're at 20 hours a week or they're at 40 hours a week or whatever they are, if they complete 2 calendar weeks and they haven't called in, then they get their next $50. And then if they complete another 2 weeks after that, they get another $50. So you can dole it out over time, and actually that's probably between the time they come in for an interview and the time they've completed 4 weeks of actual employment, you're looking at 6 to 8 weeks. So you don't have to dole out the money all at once, and they get a little extra bonus every time. But you need to be clear when they inquire with you how that money is given to them, because if they're just in it for the $200 right today, then they're not going to follow through with anything. So that is what I would recommend. You may have better ideas out there, but if you're going to do a hiring bonus, stretch it out over time. Okay, now I'm rewinding a little bit. So if you were in for our first pivot webinar that we did, and I can share the links with you to all the ones. So this is deep dive number 2. We did a huge webinar that covered all these things. It was the big pivot, how to do market during a pandemic. And then then deep dive number 1, we talked about Google Ads and Google My Business for marketing and how that works. And lots of folks have come on board for that, and that's awesome. And every time we do a webinar, I want to give you what our philosophy has always been and continues to be for sales, marketing, and recruiting. And that is that your website should be the hub for everything you do. Your website should work with you, and you should use it as much as possible. Now, it's not possible for recruiting in every single case. I totally understand that. But if you can use your website for forms, to drive traffic to the page where your ads are listed, or your openings are listed, whatever you can do to drive traffic straight to your website and to get more employees or more potential employees to fill out forms, that's where you want to be. And then if you have a CRM, that should deliver. And when you put those two things together, I'll show you what that looks like in a second, then at the end of it comes more revenue. Even if we're talking about recruiting, when you're doing it effectively and you're saving time and you're saving money and you're not using 40,000 different softwares, you can save some money if you work together. So what is a CRM? I've said this is the third time I've defined this, and it can be a lot of different things. A CRM is a contact relationship management platform. It could be your Excel spreadsheet. It could be your Outlook. It could be your Gmail, Constant Contact, HubSpot, or what we have, which is our Smart CRM. It could be any of those things. So as I talk, just keep in mind that if you use a different CRM than the one that we have, that's okay. Find out if the functionality that I'm talking to you about and helping you learn about is available on the one that you use. And if it is, awesome. If it's not, and you're looking for something else to help you organize your recruiting efforts and get more out of it and get more people in the door, then I'm happy to talk to you. But this isn't meant just to sell what we have. It's also meant to educate you on the best practices that we've seen across the board without locking you into long-term contracts and all kinds of other crazy stuff and having to use 5 different softwares. Okay, so everyone has their own needs and preferences. I totally get that. You have your own budget. You have your own way of doing this. And so as I talk, CRM means a lot of things to a lot of people. All right, keep on going. All right. Sales funnel organization equals no follow-up failure. When you're recruiting, you are selling. Whether you like it or not, it is a sales process. And I don't know how people do what they do when they are excellent recruiters, because frankly, I would burn out in a second. So keep an eye on that. Recruiting today is different than it was 10 years ago, different than it was 5 years ago. Recruiting today is a sales process. You have to sell the fact that you're a great organization to work for and that you are going to, respect and treat your caregivers well in order to get more caregivers to come on board. Lots of people will inquire, but only a few will actually make it through the process. You all know that way better than I do. So recruits are coming in. Potential employees come in through Facebook, your website, organically on Google. They even click on your Google ads, your email list, website chat. We have found that if we add a chat feature to our website, which we offer and we don't charge our clients for, when we do that, lots of job inquiry folks come in. That doesn't mean they're all qualified and amazing, but if it comes in, okay, hallelujah, let's get them on to the next step and see what happens. So website chat, phone calls, employee referrals, Indeed, ZipRecruiter, and Craigslist. So all these people are coming in from all these different places. Can the person who is recruiting keep track of all that stuff? If they have their website working with whatever their CRM is, maybe it's going straight to an Excel spreadsheet. Every single person that calls or comes in from any platform, you're very good about putting them on an Excel spreadsheet. That's great. Or maybe automatically you have it set up so that voom, 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 every time somebody inquires, they are added to your CRM, whichever one you use in the world, and you don't have to worry about it. And there's a follow-up message that goes out. They get a text, they get, maybe they're added to your monthly newsletter list. I don't know, maybe they are set up with a task for someone to call them and reach out to them, or an appointment to come in. Maybe some of it's automated and most of it's manual. They get one-time emails or text or whatever. So however you're organizing this is how it should look. You should have people coming in, inquiring for positions from all these different places. And they should be going to one central person and location and software, and think on the back end, it should be helping you. And if you don't know how to make it help you, then reach out to the people who you bought the CRM from. Except for Excel spreadsheets, not going to send out a text strip campaign or anything like that. But if you actually subscribe to one of these services, like what our clients do, then make sure you ask, how do I do all these things? And can you help me set it up? And they should be willing to do that. All right, so that's the best way to keep it all organized. I said this before, but it is a numbers game. So by now, anyone in the senior care market knows that you have to get some number, maybe it's 100 of inquiries for jobs in order to hire 3 employees. You know it's a numbers game. I know it's a numbers game. I see our clients' CRMs and their funnels filling up with hundreds and hundreds of inquiries. And they may only hire 5 or 10 people out of 100 because they're not, for whatever reason, people aren't following up. They're not meeting criteria. But the good news is this. It's not that some of them aren't qualified at all. It's just that they got a better offer or they moved on to somebody else. But if you have all those people in your database and you have them marked correctly, you can go back and say 3 months from now, hey, anybody out there looking for a new job? To the people that you already have. You want to get rid of folks who are convicted felons or who are not ever going to qualify to work for you 100% ever. Get rid of those. But the people who just didn't finish their paperwork, who didn't come to orientation, who didn't, those are all red flags. I get it. But it's a lot of people. So maybe they're in a better place today than they were. It's a numbers game. You have to keep reaching out to people, keep reaching out to them. Their lives change, their situation changes. They may need you. You need them. So decisions you need to make. When I see a home care agency or assisted living facility or a nursing home, and I look at what their staffing, what their recruiting challenges are, one of the things that I always tell people, especially if you're kind of new to this, you have to hold someone accountable for follow-up and hiring. And when you're brand new starting out, that's kind of a hard thing to do. You're kind of wearing all the hats, and trust me, I get it because I wear a lot of hats. And I know that when I delegate a project or a task to Dawn or Melanie or Jennifer or somebody else in our company, they'll actually get it done. I can think of all kinds of great ideas, but you asked me to follow through. I will for a while, but I need to delegate that to somebody who I know will follow up and do a great job of it, because that is not me. So who is the primary person who will follow up and will follow through with the process of hiring in your organization? Maybe that's more than one person, but whoever those people are, they need to be accountable. And the other decision I see, and I'm going to show you my philosophy on this after doing this for lots and lots and lots of folks, is do you want to triage or no triage? Okay, so I'm going to explain what that means. I believe in the triage. Some people do not believe in the triage. I think it's my philosophy is also butts in the door or butts on video, whatever, is part of the game. You got to get butts in the door. So to me, triage becomes important. What does triage mean? I'm going to tell you what it means. This is my favorite process. It saves time and it saves money and it saves hassle. Every time we do ads, we set up anything for our clients that has to do with recruiting. We make sure that we know if they want to triage the people before they have them fill out an application. I believe that it is fairly ridiculous to have someone fill out a really, really long application just to know by the third question that truly they wasted all that time and they are not going to work for you. Triage questions are deal breaker questions. If you've ever used ZipRecruiter or Indeed, you will know what I mean by that. They ask you, what are your deal breakers? Well, they have to have a car and they have to have a valid driver's license. Without that, they cannot work for us, period, end of story. Now, for some of you, that is not a deal breaker. You are in the middle of New York City, and it doesn't matter if they have a car and a driver's license because a lot of people don't. So that's okay. But for those of you who live in a suburb or work in a suburb, or you're in not a big city or you're in a rural area, they have to have a car and they have to have a valid driver's license. So everybody's in a different situation. Maybe your deal breaker is that they have in New Jersey and New York, they have to have the right CHHA. They have to have a New York CHHA or a New Jersey CHHA. If they don't have it, they're out. In the state of Missouri, you don't have to have any license. You could just be a caregiver. You could just be a caregiver who has experience and still work for a home care agent, a non-medical home care agency. So what are your deal breakers? What is it that you know? Of course, felons are always a deal breaker as far as I know, and background checks can also be deal breakers, but you can't know that right off the top. That's not a question you're going to ask. What are your deal breakers? And then do your interview, then do your interview or your virtual interviews. I know some people are doing them on video right now with Zoom or with other platforms that you choose to use, which is fine. I think an in-person interview obviously is always going to make better sense and give you a better feel for that person. But right now that's impossible. And maybe virtual interviews work better. I don't know. I get a good feel for a person on a virtual interview if they're, unorganized, in a loud place, didn't plan ahead. You're not sitting somewhere quietly. I get it that the dog barks and the baby cries. But if you're getting gas and trying to interview with me, that's probably not someone who plans very well, right? Okay, and then application. So it goes from triage. If they answered all the triages correctly, then they interview. And if they interview correctly, then I'm having them fill out a full application, and then I'm having them do orientation and the rest of their paperwork. So this is the process that I see working well, because you can triage people with questions and know right off the top, no, 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 yes, 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 and then start getting them in the process of interviewing and applications. So not everybody would agree with this. Maybe you would switch things around a little bit, but from what I've seen, this works really well for really big companies. Just think about it. Okay, so for me, triage means less wasted time. What are your deal breakers? Car, driver's license, CNA, HHA, PCA, RN, LPN. Maybe they have to have 2 years of experience. Maybe that is totally a deal breaker for you. You don't want newbies, and you don't want anybody less than 2 years of experience. I think that weeds out a lot of people, but I totally understand it. So if that's what you require, that's what you require. Passing triage equals potential for hire, and they can move to the next phase. Okay, so that is my triage experience. I'm going to take a breath here. Does anybody have any questions? If you would put them in the Q&A section, that would be awesome. Questions so far about anything we've talked about wish list, triage, getting your numbers together, anything. If not, that's okay. We'll keep going. All right, so I'm just going to take, and do you like my background? Yeah. Okay. Somebody raise their hand. If you have a question, put it in the Q&A section. Is it appropriate to have the potential hire do the application before the interview? Well, of course you can. You can absolutely have your folks do a full application before your interview. You can mess around with this however you want. I just think starting with a triage is nice, because then you know right off the top who you don't even want to bother with. But yeah, you can move these around. You have them fill out a full application if you want. It's totally okay. Yeah, however you want it to go is totally okay. I just think starting with the triage really helps a lot. Anybody else? I see, do you have links for the previous webinars? Yes, absolutely. I'll put that in the, when you get your follow-up from this will be tomorrow. You'll get a link to this one and a link to the first two as well. So if you missed one and you want to watch it, all of them are on our website, but I will put links to all the previous webinars and the registration for the next one, which is super cool, because we're going to talk about virtual events and how you can do it. Okay, there we go. All right, let's start with the ads. Just showing you some of the things that we do. This doesn't really show you a whole lot as far as the ads go, but on Facebook, I'm going to focus on that because that's the easiest. I just wanted to show you some numbers. So for like Indeed, for home health aid, personal care aid in Lancaster, PA, we have 56 candidates sitting there and 1,577. So what happens is we're going to focus on Facebook for this discussion, but for these other two platforms, what our clients say to us is this: I don't want to fool with this. I don't want to fool with this. Can you fool with this for me? And we say, sure, we'll fool with it for you. And we put the ads up there, and we make sure that we are making sure that the candidates that actually pass triage are going straight into our client's CRM account. And they appreciate that greatly. They don't ever have to look at this again if they don't want to. They can if they want to, but they don't have to. we have a process for doing this. So that's an aside though. Let's talk about Facebook, because a lot of you are using Facebook right now. I want to show you this ad. First of all, Facebook has a jobs platform. I get it. We don't use that. Beep. Do not use that. Well, you can use that. If it works for you, go for it. But we don't use that one. What we do is we put an ad on Facebook. And okay, so my understanding, and it's been a little time since I've looked at this, is that if you use the Facebook jobs platform, that the minimum you can spend is $10 a day. I could be wrong about that, but I think that's correct. The way we do it, you can spend as little as $5 a day if you want to, which I think for some people who are not in the middle of Manhattan or Chicago is probably an okay thing to do. If you're in a rural area and you only want to spend $5 a day on recruiting ads, you can do that, and that saves you $150 a month. So what we do is we put an ad out. Now, you can't see the whole ad here, every word. Everybody's a little different. But what I want to illustrate on this ad is the first 2 lines and the emojis. Do you see that? That attracts attention. So what we do is we put 6 ads for our client out there. And you can do this too. Go to Facebook, create a campaign, an ad campaign, and make 6 ads. But just know this, that when you create an ad in Facebook or anywhere for that matter, if you add a little color to the top, you can't put colorful words or anything like that, but you can put emojis in there. So put an emoji thing in there. And then the first 2 lines, trust me when I say this. You see how it says see more? No one clicks on see more. Okay, maybe 5 people do out of 100. All they're going to read is what's right here. And then they're going to click on apply now. And if they don't click on apply now, they're going to comment below the ad. You see this? 220 comments. 643 engagements and 220 comments on this one ad. This is in Houston metro area. So you have to look at these comments. If you don't, somebody's going to write, well, they're awful, they suck, and you have to delete that comment, because then your ads will fall off. People will stop clicking on apply now if they see a person, and you know you have caregivers out there who will do this, say that you all are horrible, or they got fired, or whatever, or something negative. Don't do it. Don't ignore this, is what I'm using. Make sure you're deleting those. You can delete them, and you can ban them from your page. Another whole lesson in Facebook. So make sure these are positive comments and that you're responding, because instead of hitting apply now, people think if they comment on this ad that you're just going to call them up and hire them, and that is not true. You need to reply to the comment and say, please go here to fill out our application or answer our questions or whatever it is, or call our office, something else. You have to reply and make sure that your 643 engagements are positive. So if you're going to use Facebook, you don't have to use the Facebook jobs platform if you don't know how to do it, or if you think it's too complicated or too expensive. You can just do straight up Facebook ads, and they work just as well. When we do this, we have 6 different ads that run. They all say the same thing, but the pictures are different because people in different parts of the country respond better to different pictures. But what I can tell you is that they all respond nicely to smiling, happy people. So smiling and happy is with their face full on in the ad. That is always a happy, you always get a good response. If it's something weird or a chair or somebody not facing the picture, then you don't get a good response. So this is what that's my advice on ads. You can save money if you get more responses if you use a little color, and you also have different pictures so you can see which ones work the best, and make sure you're responding to comments, especially if you're in a highly populated area, and don't let any negative comments linger on your ads. Okay. Your open jobs, do you put them on your website? Some of you do, some of you don't. I have seen this all over the map. If you have a WordPress website, there is a plugin you can use, or we can use, that lets you add your current jobs to your website in a nice way. So in other words, yes, you can just copy and paste the text to a new job in your website and let it sit there. That's fine. But if you want it to interact and you want it to actually work and look nice, you can put a plugin on your website that's pretty simple and it's free, and it will let you list all of your jobs. The other thing that happens when you do this is that, have you ever been searching Google, like to look for yourself, your own business or whatever, and you notice there's a bunch of job ads in Google? Well, Google, you can't go to Google and put up a job ad. That doesn't work. It aggregates from all the places, from ZipRecruiter, from Indeed, Glassdoor, maybe Facebook, I'm not sure. And it has a little listing of all the, for whatever reason, little listing with little logos of all the jobs that are available in your area for home care. Like if you type in home care jobs, Naples, Florida, then Google will show you a list of jobs that it can find on the internet that are available. If you have a plugin like this on your website, it will also make your jobs show up in that little Google search. So just a few little things, little tweaks to your WordPress website, and you have your own little job application. I'm not saying millions of people are going to come here and apply, but it looks nice and you can move them on through your system the way you want to. And it also shows up on Google. So this is a free thing that you can do, or it may take your web developer, may not be free to install it, but the plugin itself is free. So that's another thing you can do to save a little money and get your jobs out there. So I'm just a reminder, all your recruits are coming in from all these different places. We just talked about a bunch of these. They go into your CRM and they come out on the other side in an organized way. And here's what that looks like. Let's see, wait a minute. I want to show you something else and it doesn't show in here. What is it? Okay, so let's hit escape for a second because I wanted to show you something. Oh, what am I doing with it? Oh, here it is, way down here. Never mind. We'll keep going. Look at me. Okay, so when people come in and they use a CRM, and this applies to a lot of CRMs. This is not exclusive to the one we use. When they come in, they start out in this column, answered recruiting ad. And then you can move them. You can just drag and drop them. I can't do that here because it's a screenshot, but when people come in from all those different places, they should come in and they should be in a spot where they're organized. So you know that Elvira answered a recruiting ad. If Elvira answered and you clicked on her name and you saw that she doesn't have a car and that's a deal breaker for you, you should be able to just move her over to not applicable. And the system sends her a note that says, sorry, Elvira, we require that all of our caregivers have a car. If that situation changes for you, please let us know. You didn't have to do anything but go like this. Move her over. The system knows it's a smart CRM, so it knows to send her that note. If she has been contacted, you sent her a text, you sent her a message, you can put her here. Interviewed, interview no-show, application completed, invited to orientation, orientation no-show. If you move my head out of the way, you'll see this last one. You can drag and drop my head anywhere on your screen. Orientation no-show, and then hired. So you can see that if you have a CRM, you should be able to drag and drop people to the right column. If you're using an Excel spreadsheet, you should copy and paste them into the column where they are so you can keep track of who's done what where. And then you kind of have an idea of what's going on. But this kind of a CRM, holds true for many of them. If you move someone over, the CRM will send them a little note from you. Or you can do it yourself, either way. All right? Then your staff should be notified instantly. So this is what happens when clients use our system, and this can happen for you too. If somebody fills out a recruiting form, or a triage form, as what I call it, from a job ad, let's say on Facebook, the email that you receive should be something like this. Hi, this person filled out a form on Facebook for a job. You can view their information in your CRM and below. And here is the information to log into your CRM, which I've whited out so you can't see that. And then I also had to white out this text over here because obviously I don't want to show you the whole thing because that's sensitive, but it was their first name, last name, their email address, their phone number, their zip code, so you know for sure they're in the area that you need. And then the answers to the 2 deal breaker questions are in here. Do you have a driver's license and do you have reliable transportation? Yes, yes. All right, so now you're on your phone or you're somewhere else, but you know you have a quality person, at least triage, past the triage part. Now, what's going to happen next is up to you. Your system can send them a text that says, hey, thanks so much. Glad that you are interested. We'll be in touch. Or it can say, would you mind filling out our application? Here's the link. We're so excited. Or whatever you want to do. So you can have automation going on in the background to help you move the person through the process more quickly and keep them engaged with you. And 99.999% of these people are on their smartphone. So you want to text them instantly and you want to tell them what's going on. So here's what that looks like. You want to communicate instantly and frequently. And also know that just texting someone, even though that's the place they really want. Now, this is our platform, and inside our platform, you can text, call, and email, and Facebook Messenger with people without ever leaving the platform. Just letting you know that. But you want to make sure that no matter what you do call them. A human voice gives them a better connection. When you're just texting them, it's not enough. It's easier to get them to respond, but it doesn't attach them to a real human person the way a phone call does. So anyway, let's start with our text. So somebody fills out a form on Facebook, let's say, and here's instantly what they receive. Hey, Jane, this is Georgia with blah, blah, blah. Thanks for answering our job ad. We'll be in touch with next steps. Please watch for text, phone calls, and email. You can text us here if you have questions. And then there's the phone number. So she's said, watch for text, phone calls, and email. These folks oftentimes are not good about checking their email. You know that just as well as I do. So if you let somebody know that that's coming, you text them, this is where they already are sitting, they're already on their phone answering your job ad, and you let them know this is coming, then that works better. Phone calls, many people don't have their voicemail set up, I don't know why, or it's full, or they just won't, and you know they're not going to answer if they don't know the number, right? So you definitely want to let them know to watch for a phone call. So the person responded inside our platform and says, hello, when will I receive a phone call for an interview? And one of the other staff members responded, hi, this is Keisha from blah, blah, blah. What's your current availability? And he says, or he or she says, hello, Keisha, I'm available in the mornings. And then what areas do you cover? Anyway, and then it goes on and on. I live in Pembroke Pines. I can cover Broward County. I have a vehicle. Okay, perfect. Are you available nights or weekends? I can do weekends. Okay, perfect. What time during the day? I'm available 8 a.m. to 5 p.m. Perfect. Please send me your email so I can forward the requirements to bring with you tomorrow. And so he sends her, or she sends her their email address right here. I blacked that out or whatever. And then I just forwarded you the email. See you tomorrow. And then the person, this is so nice. This is why I screenshotted this one because it was so nice. It says, hello, I'll be coming in today to meet with the nurses. I am also bringing in someone that wants to work for the company, if that's okay. Are you kidding me? Of course that's okay. Yeah, bring them with you. Bring 5 people if you want. So, and this is a company that does a huge amount of recruiting, and they're in Florida. So, yes, this is a nice text. You know, it doesn't always go this way, but if you're diligent about it and they're responding to you, keep communicating with them in the place where they want to be. You have one platform to log into and they're on their phones and you can text with them all day. All right, next thing, scheduling and calendars. So I'm going to guess you all have, you're looking at my calendar. You all have a calendar, something you use. I hope you do. Staying organized means making sure you have a calendar. And on the calendar, you need to have your orientation schedule. You need to have folks put in there. So if you wanted to, most CRMs have a calendar feature, and you should be able to integrate that with when your interviews are scheduled, when your orientations are scheduled, and all that kind of stuff. If you have that feature in your CRM, you can automatically, or even let the person pick the time that they want to be coming in for an interview or online, or however you're going to do that. So having a CRM with an integrated calendar is important. If you don't have that and you just use a Google Calendar or Outlook, that's okay too. All right. In the beginning of this, I talked about full online applications instead of using PDFs. You got to quit using PDFs. You got to quit using PDFs and paper because it's so 2002. I don't know. It's hard for people to print those out. You know it. I know it. It's rough. It's always been rough. And now when people are 99.999% on a mobile device, they don't even have, I'm sorry, I'm going crazy. They don't even have the opportunity to print something. So they have to go to Office Max or somewhere else to print stuff, or a friend's house, or what. It just doesn't work. So you all have, some of you are with ClearCare, or you are with other places that already have an application and it's already set up on a HIPAA compliant server. Use that application. That should be what you're using, sending people to from your employment page. Do the triage, send them to a HIPAA compliant server to fill out an application. You should be doing that. I've always told our clients, because we've created hundreds and hundreds of websites, and many times they will say to me, can I put a full application on our website? And I will say to them, your website is not on a HIPAA compliant server. That's very expensive. So I would not be asking for sensitive data like date of birth and social security number. You can ask that over the phone. You can get that later in person or whatever, but don't ask those sensitive data questions on an online application. Today, I can say to our clients, yes, we can put a full HIPAA compliant application on your website because our CRM allows us to do that. We create a form, we create an entire application, and all we have to do is embed it, or they can just click on a link and boom, it pulls up. It's on a HIPAA compliant server, and the person can fill it out right there from their phone or from wherever they are, and it's done. So today, we can say, yes, absolutely, full online application. You're already our client, and we can do that for you. So there are two options. You can embed the application on your website, and what we do is we send the code to your web developer, or if we're your web developer, we do it, or whatever, you have somebody who can do that for you. And then they put the code on your website on your application page, and it magically appears. Or if you can't do any of that, because maybe you're a franchise, or maybe you just don't have, you have a Wix website or something like that, we can just put up a page that mirrors the look and feel of your website, just like ClearCare does for you. And we can host that page for you, and then your application can be there and just link straight from your website to the application. It's easy stuff. So yes, we can do that. And when you have a CRM, ask. So most of the ones that cater to home care, senior care are already going to be on a HIPAA compliant server. You need to ask, if you're doing recruiting, is this on a HIPAA compliant server? Most of them for recruiting, they're specific to that, like a Hireology probably are. And ours is too. So when people sign up with us and they want to do recruiting, and they're in our recruiting program, we can turn this on. And if this is at the top of your CRM, you are on a HIPAA compliant account. So all that information can come in through there, and you don't have to worry about it. All right, so this is what it looks like when an application, and I can't do this whole thing because it's screenshots and it's long. You know how long an application is. So when it's embedded on your website, it kind of looks like this. This company has a lot of things I need to say up front. This was their PDF that we turned into a full online application for them. So we took everything that they had on their PDF, we completed a full online application for them, and we embedded it on their website. And then this is the same thing, but this is the version that is linked to their website. So if they didn't want it embedded on their website, or they couldn't do that for some reason, then we created this is just a sample that we created to look exactly like their website or pretty close to it. And you can just send people to this link and they can fill out your application and they see only your stuff. So that's kind of the two different ways we do it. Okay, Facebook ads budget. The minimum I would recommend that you spend on Facebook ads for recruiting is $5 a day. I think that's probably the lowest you can go anyway, pretty much. So $5 a day is $150 a month. If you're, and I would say this, you need to recruit all the time. If you're in a lull and you think, oh yeah, well, you know, we don't need any caregivers right now, you're going to find out really quickly as soon as this stuff starts to go away, which is, you know, maybe it's not going to go away for a long time, but things are going to start opening back up. People need jobs and you need to continuously recruit. So $150 a month is the minimum. I would say that's worth spending on Facebook, but do it right. I recommend that you actually spend $300 a month and up, but on the other hand, if you don't really need anybody right now, $150 is fine. ZipRecruiter, Indeed, Craigslist, and all these costs depend on your location, the number of ads you want to run, and the budget you have. So I know some people will spend $25 on a ZipRecruiter ad to kind of boost it. You can put stuff on Indeed for free, but it doesn't really go anywhere. You can put it on, and there's a trick to Indeed. There are tricks to all of these. For Indeed, we've learned over time that there are certain things that we say in the title that get way more play than and sort of search engine optimization than other things. So when you're looking at Indeed, if you put a bunch of dingbat things in the title, which is, you know, like you want to look interesting or whatever, the problem is you don't show up in search because nobody types in all those dingbat things. Even though you think it's fun, it doesn't help you at all. You want to stick to the title, stick to whatever the job is. And that takes a while to learn that and believe it, because we've tried all the things. So there are tricks to Indeed and ZipRecruiter with titles of your ads that really make them show up better so that you're spending less money on promoting them. But $25 is pretty much the norm for any of that. Craigslist, I think they charge $25 per post. I'm not a big Craigslist fan. I know some of you love it and some of you use it all the time. I'm scared of Craigslist. I don't like that. But if you get great caregivers off of Craigslist, don't stop using them. And I am going to answer questions, by the way. I see that you're asking them. Thank you so much. I will come back to questions in just a second. Okay, how can you save time and money? All right, so here's what I want you to do. You got a list. In the beginning, I asked you to make a list of all the places you're spending money specifically for recruiting. You need to combine some of that stuff and get rid of some of that stuff. So if you have one platform that lets you text, mass text, individually text, automatically text, whatever it is, text, Facebook Messenger, chat, email, and call from one platform, that eliminates the need for RingCentral and other platforms. And let me tell you something about Facebook Messenger. I see, even in our clients' accounts, because we manage their social media, so we see a lot of people answering job ads through Facebook Messenger. Somebody, if you don't have this all in one place, then somebody not only has to log into whatever CRM you're using, but they have to log into Facebook Messenger every day and answer these people. And you get used to it and you can do it, but just in the platform that we use, their Facebook Messenger stuff comes right into the platform under their name. So you can just log into one place one time and see whether they sent you a Facebook Messenger request, they called, they texted, whatever. It's all right there for you. Anyway, so you can get rid of other platforms if you have something that's kind of an all-in-one. Use a scheduling feature. If you have ever used Calendly or Appointment like we do, you know you can get rid of those if you have the right CRM. So that's another expense that you can get rid of. Less time worrying about ads, placement, spend, and comments on your ads. You set the budget, let us do the work, and then you can work on getting butts in the door. You need to have a HIPAA compliant full online application for your recruiting. Whether it's a link to the application or it's embedded directly on your website, doesn't matter. You really need to have something like that and get rid of those PDFs. And questions and changes should be no charge. So if you said, okay, well, we really need to add this question to our application or take that away, Fine, that takes 10 minutes. Just let you know, somebody should be able to do that for you. Desktop and mobile app versions available. So you should not only be able to log into all of this in your CRM on your desktop, but you should be able to have an app. So if you're on the go or you're the only person doing this and you wear 10 million hats, you can look at your phone and say, ooh, that person did schedule an appointment with me tomorrow. I have to be in the office for an interview, or I need to follow up with them real quick. And you should be able to have that on your Android, your iPhone, your iPad, whatever you use. And you should be able to export all of your applicants with all the fields that you ask them to fill out to Excel spreadsheets, CSVs, and you should be able to upload them to other platforms if you need to. So if you collect information here, you should be able to transfer it over here pretty easily. All right. What does the Smart CRM and our staff do for you? So people ask us all the time, well, what do you do that's different from what other people do? Well, I'll just give you ours and you can, what we do, and you can decide. So we create and manage all of your ads. So you don't have to do that anymore. If you say, I need more clients, we'll tell, or I mean, not clients, everybody needs more clients. If I need more caregivers, I'm not getting enough response, then we'll tell you and help you and work with you and fix your ads or do your budget or whatever to make that happen. All forms that are created are sent directly to your CRM account on a HIPAA compliant server. Your staff is instantly notified via email, and if you want, you can be texted. Most people don't like that, but you can be texted. But email definitely. If someone's trying to talk to you, you need to know that without having to be logged in to the CRM. So we make sure there are triggers that notify you of that. The potential employee receives an instant text letting them know that their inquiry was received and that someone will be in touch. So when they're on their phone filling out that little Facebook ad or Indeed or whatever, boom, they get a text that says, hey, we got it. We'll be right there with you. Organize them by category. They filled out a form. They were contacted, not applicable, interviewed, interview no-show. So organize your contacts so that you know where everybody stands. Schedule interview appointments directly from the CRM if you want to, or you can use other calendar software. Text, chat, email, Facebook Messenger, and call from one platform. You can actually call from inside our CRM. Spend as much or as little on Facebook ads as you like. Minimum is $5 a day. There are no long-term contracts. And support is by Zoom calls, meaning what we're doing right now, except for it's just you and me. Yes, we use Zoom. No, I'm not worried about our data being, it's fine. Zoom is fine for what we have to talk about. It's nothing super secret, and we don't share the videos. But we do record the videos so that if some staff member is not available, they can watch it later. And by the way, all Zoom calls like this and personal calls like, just me and you one-on-one, they are all of those links to those videos are now password protected. They weren't before. Zoom got in trouble, and now they are. And Zoom has upgraded their platform like 40 times in the last 10 days. So they're doing their job. So support is by Zoom. That means you and I, or you and somebody get on a call and we say, okay, let's screen share and figure this out together if you're having trouble with something. We also have support tickets and a full suite of videos for you. All right, so how much does it cost? That depends on several factors, but if you want to look at our stuff, you can go to bit.ly/recruitcare. So it's bit.ly/recruit care. Go to that page and fill out that form, and Bob will talk to you. bit.ly/recruit care. All right, now we're going to do questions and answers, and there's that bit.ly/recruit care. Fill out the form, the HIPAA compliant form at the bottom of that page, and we will chat with you about what you need. We understand that most recruiting platforms and programs cost a lot of money. We get it. Ours is not that expensive. All right. Do emojis attract less professional applicants in the ads? That's a great question. So if you're trying to recruit an RN, you might not want to use an emoji. In fact, you might not even want to use Facebook. Although you might want to use Zip or Indeed, or you might want to look on LinkedIn. So if you're attracting a super professional applicant, that is probably not where you want to go. But if you're recruiting the age range and the caregiver range, CNA, HHA, yeah, absolutely, use emojis. Do it. Because your ad is going to blend in with 5,000 other things, but when you put a little emoji in there, even if it's just a heart, then you'll attract more applicants. Try it both ways. Split test it. What if Elvera is moved to not applicable because of something else besides not having a car? Well, so what we're talking about there is that categorizing everybody as they come in. If she's not applicable, does it matter why she's not applicable? She can be not applicable for any reason, and you can move her to that column. And you can note in her, those are screenshots. So if you were to click on her name, you could read everything about her and you would know instantly why she was not applicable, because there's probably a note in there that says doesn't have a car, or doesn't have the right license, or is a convicted felon. So you can put whatever you want. I just move them to not applicable when we are not going to deal with them right now. Oh, and you mean the message that they send. So you have to decide if there is might want to send a generic message. So if somebody's going to not applicable, you might want to say, our employees have to meet certain criteria. Unfortunately, at this time, you don't meet that criteria. If you want details, text us at da-da-da-da. And they can send you a personal text and you can answer them with what the problem was. But you can still automate that and just make it more generic. I see what you're saying now. What CRM is in that example where you can just move the boxes? Well, that's the one that we have. It's called a Smart CRM. And if you go to bit.ly/recruit care, you can see more about that. There's also a demo video on our website about our CRM. It's under Smart CRM. You can look around there and you can find the demo where I go through. It's about 30 minutes, but you can see the demo video if you want to. Love this drag and drop option. Do you have any recommendations on CRM? Yes, I recommend our CRM. Hold on a second. Let me just show you that. Y'all are so helpful to ask those questions. I'll show you what that looks like right now. Right now. All right, here you go. So you're going to see admin stuff. Let me switch to our demo account. So this is we have tons and tons of folks in here. So it's at app.approvedseniorcarecrm.com. You're not going to be able to see anything because you don't have a login, but this is our demo account. So this is what you see when you log in. You see how many opportunities. These are humans. I don't know why it's always opportunities, but anyway, these are how many humans have answered your ad, and this shows you where people are. So if I go to opportunities, now you can see what was in that screenshot. I can move Elvera over here. I can move Danica to here, or maybe she didn't show up and I can move her to here. So this is how you move people around. And if you want to see all of your contacts, you go to contacts. And what we do is we sort them by tags. So I can go and let's see here. Let's see. We can do a Danica referral. We can sort by contact, newsletter, you name it, referral source, jobs. All of my tags are here. And I can put in any tags I want. Of course, we set this up for our clients. They don't have to go in and learn all this by themselves. We help them, we ask them what they need, and we do all this kind of back-end work for them. And then once they have everything organized the way they want it, then they can go in and make more changes as they wish. So this is kind of what it all looks like. If you were in other programs, if you scroll down, these are tasks. So if I were to assign a task to Bob or George or Kyle or somebody else, their tasks would show up here, meaning I need you to call somebody, or so-and-so called, can you return their call tomorrow? If you have Google Ads set up, you'll see your Google Ad spend. If you have Google My Business, if we have access to that, we will put in the Google My Business. This is just kind of general information, so it's not going to give you in-depth. And then your Google Analytics is here. So if you wanted to see lots and lots of different things, your schedule is here. So if I go to calendar, you can see here we are right here with deep dive recruiting, but this could be appointments. It could be anything. Look, pay your Ambetter monthly. That's my health insurance. So you can see all your appointments, recruiting, whatever you do. If you want to see marketing, you can go look at campaigns, and you can see all the different campaigns that we have in here. And those are all set up for you. You don't have to do it yourself. Anyway, and then phone calls. Phone calls are tracked and recorded. There is nothing in here because this is a demo account, and I don't want to show you a live account. But what happens is all the calls that have come in from this system are tracked. They are if they're answered, if they're missed, if they're a first-time caller, the average call duration, and then they're listed down here, and you can actually listen to the call. All of the phone numbers that we use for this system forward to your office number. So they can text in here, but if they call the number, they call your office. There's no middleman. There's no one in between you and that person. And this is also where you send out mass text. So if you need to fill a shift, you need to hire more, you want to reach out to old folks not old folks, but old people who in the past have applied but didn't follow through. You want to do what's called a re-engagement campaign, where you look at all those old caregivers and CNAs that you didn't hire, and you go back through and say, hey, have things changed for you? We'd love for you to come in, or whatever, fill out our application again. This pretty much handles everything you could ever want. That's what I'm getting at. All right, so let me go back to questions and answers for y'all. All right. What CRM is in that example where you move the boxes? I just showed it to you. It's called a Smart CRM. Love this drag and drop option. This is our Smart CRM. Is a social security number and date of birth considered personal health information and subject to HIPAA compliance? You know what? I don't know if it's PHI, but it is certainly personal information. And I would be very careful about where I entered my social security number and date of birth, wouldn't you? So having a HIPAA compliant server is probably a great idea. Do you utilize HubSpot or something like that? No. But you can if you like HubSpot, but we do not. We have our own. We have our own. For years and years, people were asking us, is there a CRM that's just for senior care businesses, that's not too overly priced, that is not too crazy and complicated, that someone will help me with, that I can use for recruiting and marketing? That's what we're all about, is the recruiting and marketing. This isn't a place where you put care notes. This isn't a place where you put health information. You can recruit and you can market here, and that's what it's for, and people love it. And so it took us a long time to put this together. There's a developer behind this. It's not us, but we have modified it to fit you, and it can be modified even more for any specific need you have, but we try to keep it really, really simple. It's our Smart CRM. Let's see. How do you recommend holding on to potential hires or onboarding folks when you're in the slow period we are now experiencing? Well, sometimes you're going to be in slow periods, and it's hard when people aren't getting hours. It's a matter of marketing. I would say if you're having trouble with keeping hours, then you need to start upping your game on your online marketing so that you can fill those hours. So if you feel like clients have dropped out because they're scared to have somebody in the house, we did 2 webinars on that in the last 2 weeks. You need to up your game on your online marketing and fill those hours. Get those hours filled up, and or ask: is there an assisted living facility? Is there a nursing home? Is there somewhere local to you that you could help staff? I mean, those are some options, but definitely up your game. Does your CRM integrate with ClearCare? That's a great question. If you use ClearCare Online and you already have all these bells and whistles, or you have the online application, you probably don't need our CRM. I've been asked this a few times, and I have not reached out to ClearCare. I have intended on doing that to see if there's some API functionality that we could integrate. I don't know that they're really that interested in integrating with us, but they might be. But I would say this, if you're already using ClearCare and you have people who are clocking in using ClearCare services, or you're way integrated into it, this is probably not something you would want to switch to. But again, some people don't use ClearCare online, and we don't do payroll. We don't do staffing through this. This is just recruiting. You can export all the data about somebody and import it into ClearCare. That's not a problem. But to do it automatically is not an option at the moment. We will check into it though. Do you have an online solution for client documents, filling out forms and obtaining signatures? That is also a great question. If the form is a government form that you cannot modify, that becomes really challenging. I don't think that we can't make that happen. But there are, shortly, we will have something similar. I don't know if you've ever heard of PandaDocs, or we use something called eSignGenie. Within probably the next 30 days or so, we'll be able to have something similar to PandaDocs. So what that means is they will be able to, like if you have extra forms they fill out for background checks and things like that, they're just kind of something that you have, then those documents will be available and they will have signature features. So that is coming, but currently we can help you with it, but we can't make them signable yet. How much is the Smart CRM program? That depends on if you want a full recruiting or if you just want the CRM by itself. And I will show you, you go to asnmarketingplan.com. This is our big website with all the stuff. And if you go up here, you see recruiting. You click on that. You can look at our recruiting information. You can see that ad right there that I showed you. And there's a form there to fill out. You can fill that out. If you want to just look at the Smart CRM by itself with no help from us, you just want to get in there and use it. This is a demo video I was talking about. It's under Smart CRM at the very, very top. And then you can scroll down and there is a form there you can fill out if you want to, but you can see some pricing there. That's just if you want the CRM and nothing else. And we do not charge per user per month, and some people do, so just know that. Is there a charge for mass texting? There is not a charge for mass texting as long as it is not 100,000 people at a time. So the first time you do some mass texting, we'd just like to help you a little bit because if you text too many people all at once, like we're talking thousands, then it's a flag for the carriers. So you have to be careful about that. But if you're just talking like 100 people, anytime, whatever you want to do. Do you have just home care clients? Would you take customers besides home care? Yes, we have assisted living clients. We have long-term care insurance. We have home care, home health, Medicare certified, any senior service. Does Smart CRM integrate with scheduling software such as HHA Exchange? No, it does not. We do not integrate with other services. We are not meant to be that way. This is just marketing and recruiting. So I hope that helps. Anybody else have any questions before I call it? I want to show you one last slide. Go ahead and type your question in if you have it. Deep dive number 3 will be next week, same time, Tuesday afternoon, using Facebook and LinkedIn to your advantage and virtual events. We have had so many people ask us to help them market their virtual events, which it's just like this, a webinar, to their local population, to healthcare professionals, referral sources, and to families. And so we have a little formula put together, and we'll show you the way we do it and the way you can do it yourself, or you can do it with the help of us or whatever. But certainly virtual events are a great way to continuously reach out to people and to get people involved with what you're doing and your company and see your face and give them some really good information. So we are going to talk about Facebook marketing, LinkedIn marketing, and virtual events, all 3 of those things, and how they can work together and how they can work separately. And that is next Tuesday. I will send, there's the bit.ly link if you want to do that. It's bit.ly/virtual marketing 123. If you go there, you can register for it. But I will send out an email about that, of course. Anybody else have any questions before I go? La, 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 la. I think that's it. Okay. Thank you, everybody. Thank you for joining us. I hope you learned something. I hope you are involved with the right CRM in the right places, and that you are using Facebook ads and those other things to your advantage and getting lots and lots of use out of them. Thanks, everybody. We'll talk soon. Bye-bye.